Hey everybody, welcome to Healthcare Sucks. I wanted to just bring you some more things to update today. People are losing it. They're starting to get mad over there, man. And I don't blame them. There's a lot of crazy stuff going on. I'm going to run through some videos and comment in the background, guys. And hopefully you'll get to hear all this. Uh, I'm From now on, everything I'm putting out is under the free uh, News Act, whatever it's called, Freedom of Press Act, etc., which means I'm just reproducing or producing things. My stuff you can reproduce, guys. Feel free. If we can save a human being or save us from some misery, feel free to pass it on. To start with, we're going to look at this guy getting mad. And I guess he's saying his relative is dying. No beds, no oxygen tanks available. In other words, they're running out of everything, guys. He's lucky he didn't get shot, huh, guys? Over there. I mean, that's like nuts. And if I could translate that for you, I'd say he's using a few different four-letter words, guys. And we probably would too, guys. I mean, don't get me wrong, the staff is probably doing everything they can do right now. Literally. Let's check this out. We got people laying in the road dead now. No, it's not just a homeless guy. It's somebody very sick. And this is a guy, I guess, that they're taking busloads of people into quarantine. You're not hearing about this. And we're hearing stupid impeach crap on TV, guys, when this is going to be hitting home real quick over here, man. This thing's way out of control. Like I told you the other day, I met this guy, did an interview. He's got some contacts with CDC and DHS and things like that. And he said they are holding back. Watch this guy. He's like, he didn't get shot. Yeah, he's calling security, guys. The jig is up. We'll kind of skim through a couple things to see what we got on this one. This I found interesting. Bunches of people singing together, yelling out the windows. More or less, you know what? They're going to be trapped like that, guys, like out of a movie. Look at that. It's getting nuts completely, guys. Tell me that ain't nuts. crazy. These guys are playing in plastic bag masks, elderly to stay safe. Tell me that is not nuts, man. That's nuts. Just completely. This guy we're going to listen to next, he's going to break down a little of what's going on for us.
Well, welcome to this talk, and I wanted to give you an update on the coronavirus, which is in the news. Now, there's quite a few things we don't know about this virus, but there's quite a few things we do. So I thought I wanted to talk about that, and I want to tell you about some practical implications as well, how you can protect yourself, how you can protect your family, and this will be interesting if you're a healthcare provider, a healthcare professional, or you want to be a better informed member of the public who wants to protect themselves. So these are electron micrographs of the coronavirus, and they're remarkably small.
Welcome to the new studio, guys. We'll get a better look later, but I want to share some of this with you. I'm going to turn it up.
Shaped appearance because of the outer protein coat on it. So I've run up a few notes that we can think about to try and start thinking about this coronavirus. So coronavirus, CO corona, V for virus, coronavirus. Now, really it's coronaviruses, that there's lots of these viruses. And it's a large family of viruses that cause illness ranging from the common cold to more severe respiratory disease. This is in humans. Now, the coronavirus, as we'll see, comes from animals. And in animals, it causes a lot of different pathologies. But from now on, I'm just going to be talking about the disease states as it affects humans. And of course, as it's spreading from China at the moment. Now, we've known about quite a few coronaviruses for a while, but a new coronavirus was identified in humans on the 29th of December 2019. And it was a novel virus. It is new, it hasn't been seen before. So for that reason, this virus was assigned this name, 2019 novel coronavirus. So 2019 NCOV. That's what it means, the novel coronavirus discovered in 2019. And what it does is it causes human respiratory viral infections. So we're talking about infections of the respiratory system. Now, of course, we can have upper respiratory infections in the nose, the pharynx.
In English, that's respiratory.
Depends where you count. Upper.
Normally,
upper would be above the level of the larynx. So upper respiratory infections and lower respiratory infections, bronchitis in the bronchial passages and infections lower down in the lung fields in the alveoli. These are all respiratory infections. And respiratory infections can be caused by bacteria or viruses. And of course, these ones are caused by viruses. This is a coronavirus. But there's a wide variety of viruses can cause human respiratory viral infections. So the common cold, for example, is actually different viruses can cause that. A coronavirus can cause common cold type symptoms, but the most common one is called a rhinovirus, rhino for the nose. And we get this characteristic irritating runny nose and general malaise and the features of a common cold that you're all familiar with. Or influenza is another type of respiratory virus. This causes flu. So it's an influenza virus. There's different types. But this is the main cause of seasonal flu, the flu that we get more of every winter. And there was a quite outrageous outbreak in 1918, 1919. In the West, we called it the Spanish flu, and it killed about 50 million people when a virus mutated.
50 million people, Spanish flu, 1918, when it mutated, and it just killed off 50 million? I didn't even know that, guys. That's like crazy. That's almost like one of the rat plagues overseas, you know? Crazy stuff, guys.
And when the virus mutated, this effect so-called genetic shift. The virus shifted. It was a new genetic form of the virus. And what that meant was it expressed different proteins And these were proteins that our immune system was not familiar with. So we didn't have immunity to it, and it caused severe illness, inflammatory reactions, and it killed young people and old people tragically. So different viruses can cause human respiratory viral infections. But thinking about the coronavirus particularly is what we want to focus on, because that's what's new. We've had these other viruses for a long time. Now we've got this novel coronavirus. Now, the coronavirus is single-stranded RNA. It's a ribonucleic acid virus. And it's in a protein envelope, and this is a protein shell or capsid. So we've got this genetic material in the middle. So if we could see it here, we'd have strands of RNA in there in the middle. And this that we see outside is the capsid, the protein envelope or the protein capsule. And we'll see that this is very important for spread later on, because this can protect the virus when it's outside of the body, and it can.
And that's what I've been telling you guys is you going to get it when you're shipping goods out? How long can it attach itself to something? In other words, live outside of the body, the human host. And we're going to 5 days so far anyway. That's the answer that we were looking for. 5 days. Here we are. Just a minute. I'm going to try to skip through some of this and just hit the highlights. And you guys can go back. I'll put it in who this is. You can go back through and watch it yourself.
Survive on surfaces for a few days because of this protein envelope that surrounds the RNA. And they're very small. Well, we've seen the crown shape. They're very small, 100 nanometers. 100 nanometers. So that's 1/10 of a micrometer. So on this scale, a micrometer would be viruses. And now we have this novel, previously unidentified one, the 2019 novel coronavirus, which is currently causing.
He's talking about the 3 MERS, SARS, and now they're calling it a novel, previously identified. You might as well just call this the, quote, stolen by 2 China people from Canada out of their class 4 lab. Yes, that's what happened. And we're going to talk about that off and on. Basically, go to BP Earthwatch, watch the video. He goes into it. God Rules is covering this. A few other people. Bottom line is 2 people from China infiltrated in to do lab work at a lab up in Canada. They stole it, passed it on, got caught. Probably slap on the hands because diplomatic immunity, as they said in Lethal Weapon, if you remember that. Diplomatic immunity. So we're going to go on to some of the symptoms. Everybody was wondering about this.
Illness. Now, what are the clinical features that this novel coronavirus will cause? Well, the data from China is somewhat limited at the moment, but this is the latest data as of a couple of days ago. So the people that got this condition, 98% of them had a fever. So basically everyone who had this disease had a fever. They were pyrexial. So what happens here is that toxins are released from the virus. That's detected by the immune system. The immune system facilitates prostaglandin mechanisms in the hypothalamus, turns up the set point of the hypothalamus, and then we feel cold and shivery. We can have these rigors. Rigors is the cold, shivery feeling, because when your temperature's going up, you feel cold. That increases the body temperature and gives us the fever. Now, this is actually a good thing, because the viruses are less comfortable in pyrexial environments, and the viruses don't replicate as well in a fevered patient as in a patient with no pyrexia. And as well as that, the increase in body temperature increases the efficiency of the immune system. So we need to see fever as an adaptive defensive mechanism that's going to help us combat this infection. But it's a clinical feature that we can detect.
Which I didn't know, guys. Honestly, I knew different things off and on, but I didn't know that when the fever kicks in, it's technically kicking your body's immune system into go, and the good guys come out and they're kicking ass on the bad stuff, and they're taking it out and taking them out, and that's what's happening. They're coming out and doing their job, and it helps to have the fever. Apparently, it initiates that. We're going to go on to another symptom.
Simply by taking the patient's temperature. 76% of the patients so far analysed who've been affected with novel coronavirus have had a cough. Myalgia is pain in the muscles. Remember, you've had flu and you just ache everywhere. You start getting an ache.
Okay, that one I could test to. I have systemic lupus. I told you guys. I've had a few viewers wondering, because I did a hospital video today. I have a few different chronic illnesses. One is systemic lupus. And so my body and my bones ache, and it's rheumatoid arthritis. I have that really bad, among a couple other problems I have, besides some fused, messed up back problems. Won't go into that. A lot of people deal with that. Many years ago, I was taking a drug called Imuran for the lupus, and it was giving me cancer, basically changing my cells around. So yeah, another wonderful thing with treatments and things out there. Real quick, I said we were going to touch on this. I'm going to do a full video on this. I'm one of only 40 people in the United States, guys, that is on a drug called Rapamune for lupus. It's used for other things. It originally was called Rapamune. It's also called Sorimus. I'll have to get the spelling for you. Same drug. One's generic, one's not. I actually looked this up. Great movie, To Age or Not to Age. And I did research on that. Then God sent me a message, more or less. I was looking for treatments because I kept getting worse and worse to where it was just taking me down and killing me. And there was a message about some special treatment in Syracuse, New York, under a Dr. Pearl, Andreas Pearl. You can look it up. And it was that same drug from To Age or Not to Age. What Rapamune is an anti-aging drug. It's supposed to give you longevity of your years, which basically the elites, the real rich, would be taking it to live longer, redoes things to your blood and your cells and stuff, and revamps. In my case, of course, it helps with my systemic lupus. I don't know if I'm actually getting younger or any of that crazy stuff, but you never know. Hey, right now, just to let you know, I had a really good doctor here in town that was working with me on having that exploratory medicine. Well, she had her disease, she has kicked in, and she's retired. And we got some bozo now taking over the clinic, and he may not work with me because he's one of these new wave. I mean, just because the tires are good and the car's running good, let's tear it apart. In other words, I've had no side effects for 5 years on this drug. It's doing very well, making me better. And this bozo wants to come in and change things around. I told you, healthcare sucks. It's one of the sucky things. But I have another doctor that may come in, so I may get to continue. Hope to God, man, because the side effects from systemic lupus will kill you eventually. With that, we'll jump back into the film. Sorry, I just wanted to explain that because I've had a lot of questions over my health and stuff, and sometime we'll do the whole film on it, and we'll get out the movie Age or Not to Age. It's great. Anyway, back to symptoms.
Back and achy limbs, myalgia, and fatigue, 44%. I think it goes without saying with these infections, you just feel awful. You have general malaise. I had influenza flu a few years ago, and I just felt so ill. I mean, proper flu is so ill. When you say you can't lift your head off the pillow for a while, you can't lift your head off the pillow. And I remember thinking, I don't care if I die now. At least I'll stop feeling this ill. You felt so sick.
And we've all had that where we're just so sick. And then sometimes you get the next few symptoms, you're vomiting and going out the other end, and you're just like, ugh. You know, it's just terrible stuff. I want to let you know if the film suddenly stops, we'll do a part two. I'll come back and record some more. Uh, my recording device I use has had some issues lately. I don't know what's going on, but since I've started covering this new topic about the China virus, I've had all kinds of mysterious phone little problems, guys. Anyway, back to the education.
With the influenza and with the coronavirus, I assume these patients are feeling remarkably ill as well. 28% produced sputum, as you might expect with a respiratory virus. 8% had a headache. 5% had hemoptysis, coughing up blood. Now, 3% had diarrhea, which is interesting. So this virus seems to affect primarily the respiratory system, but also the gastrointestinal system, which is interesting. And 55% developed dyspnea, difficulty in breathing, shortness of breath. So thinking about the complications of this.
And I had a meeting with the doctor today, and that's the one that gets you. Is what's bad with this is once it goes into the lungs, it fills up your lungs with contaminations, basically pus and other things. Just makes you very, very sick. And at some point, if you don't get treatment right away and get oxygen and things going, cleaning things out and pumping your lungs and all that, you're gone. You're history. So back to the
of this condition. So severe acute respiratory infection is pneumonia. So you probably know that in the lungs we have the air sacs, which are the alveoli. So we have the air sacs in the lungs here, these alveolar air sacs.
I love this guy. He's actually of the medical profession. He's like a Dutch sense. You know, the great Dutch sense, earthquake detective. Taught us all. Still out there a little bit, but they've really treated him bad. But anyway, he's the great master detective of the earthquakes, if you didn't know, and he goes into everything. This guy goes into it too, man.
Gives us a nice large surface area over which gaseous exchange can take place. Now, pneumonia is infection at the level of the alveoli. So bronchitis is going to be the larger bronchial passages, not that one. That one there's a bronchial, not that one, but the larger bronchial passages in the bronchial tree is bronchitis. But pneumonia is actually affecting the lung at the level of the alveoli, and we get consolidation, we get fluid collecting in there. And of course, if there's fluid in there, the oxygen can't get in, the carbon dioxide can't get out. So that's pneumonia. So pneumonia is a complication of novel coronavirus. As with the other coronaviruses, that pneumonia is a complication. Severe acute respiratory infection, which is pneumonia. And also acute respiratory distress syndrome. Now, acute respiratory distress syndrome, ARDS, occurs when the lungs become inflamed. For any reason. It can be infection, it can be injury. And the inflammation causes fluid from the nearby blood vessels to leak into the alveoli. So the net result really is much the same as pneumonia. You get fluid in the alveoli caused by acute respiratory distress syndrome. And the patient will become very short of breath if they've got ARDS, and rapid tachypnea, rapid shallow breathing, tiredness, drowsiness, confusion, and they can feel faint as well, because what it basically means is we're not getting the oxygen in. So the oxygen might be coming down here, but it's not getting into the blood. So the oxygen in the blood is going to go down. That's called hypoxemia. And of course, if the oxygen in the blood's going down, if there's a hypoxemia, there's going to be a hypoxia. Not enough oxygen in the tissues of the body. So we know these are complications from the Chinese data. If we take chest x-rays, then we find that there's consolidation in the lungs, as you would expect. The areas which were hollow with air have become solid. They've become solid, they are consolidated. Now, other information that's recently been gleaned about this virus is the median duration from illness to the onset of dyspnea is 8 days. So it seems to take some time for the inflammation in the lungs to develop. And the median time from onset of symptoms to first hospital admission in China, the Chinese data was 7 days. The time from the onset of symptoms to patients that needed mechanical ventilation, which thankfully was the minority of patients, but that was 10.5 days.
And that's what I was telling you. If you can't breathe on your own and your lungs fill up and they're clogged up, you can't breathe, you have to have a machine. Just checking the film, guys, because I got to know when it cuts off.
Again, to me, this indicates it's taking time for the inflammation to develop. And interestingly, these patients developed a leukopenia. Now, we do see this with infections. Leuco is the white blood cells, penia is the deficiency of. So this is in the early stages, there's a leukopenia, a reduction in the number of white blood cells. But the particular type of white blood cell particularly involved in fighting viral infections are the lymphocytes. And initially there was a lymphopenia, a reduction in the number of lymphocytes. Now, traditionally, it's been said that the virus can adversely affect the bone marrow, but as well as that, the lymphocytes might in some way be used up fighting the infection. So initially they go down. Later in the infection, as the immune system compensates and develops, we would expect a leukocytosis and a lymphocytosis, an increase in the number of these. But if you're a healthcare provider, it's important to realise that a lymphopenia or a lymphocytosis can both be indications of viral infection, as we would expect, of course, because the coronavirus is a virus. Now, how is this transmitted? Well, we've said it's a zoonosis. It's direct from animals. So, for example, the Middle Eastern one came from camels. The other one, this
SARS.
one, the SARS, the severe acute respiratory infection, that came from a type of wild cat, I think it was. It was some sort of wild carnivore, anyway. So again, these are coming from the wild. They're coming from animals, and of course, in China, just in the past few days, not before time, I might add, they've banned the trade in wild animals for meat, because this is where these, apart from the ethical aspects, this is where the virus comes from, because it's zoonotic. So direct from animals, the animals will be the vector.
And that's what they're saying, is it came from animals. And there's other films out there, I'll try to get to some of those for you, where they're actually showing they were eating warm wolf meat and bats and crazy stuff like that. I mean, OMG, guys. I mean, if you eat garbage like that, you're bound to get stuff. But back to where this came from, this was lab produced. So either an animal escaped from their lab or this was intentional. Yeah, I'm going to come out and say it. And with that, there is a theory going around. I might as well throw it at you. If you were going to do something like this, you would, at the best time to get the most coverage, like 12 Monkeys syndrome or The Stand or something like that, what happened is they send it out to the people, and the people are getting ready to go on holidays and spread it all over. And think about this, Super Bowl Sunday, guys. Super Bowl Sunday. Man, you couldn't pay me enough to go this year. The risk and the dangers, not me.
But now this virus seems to have got into humans and mutated, and it can now go from human to humans. So it's now being transmitted from human to humans. We now know this. And it's transmitted by droplet infection. So a droplet infection is when you're breathing, when you're coughing, when you're sneezing, then there's little bits of moisture come out. And the viruses are shed by the respiratory mucosa, which is infected. And they're in this moisture that's breathed out, coughed out, sneezed out. So this is what we call a droplet infection. And this can go into the nose of someone else, the mouth of someone else, the eyes of someone else, into the mucous membranes, causing infection.
Eyes, nose, mouth, you can get this.
So in that case, animals can be vectors, and of course humans can be vectors, because a vector is anything alive that's transmitting the disease. So it's a droplet infection. This is why we say coughs and sneezes spread diseases. And over about 2 meters as well. So if someone sneezes,
coughs and sneezes spreads diseases. Hey, that's kind of catchy, man.
2 meters away from you, they can still infect you as the droplets go through the air, especially if they're sneezing and not covering their mouth properly. And we want to stop these viruses getting into the air, so we don't want to be blowing our nose like that. We want to be blowing it into a tissue. This is called catch it, bin it, kill it. So we catch the virus in a tissue, we put it in the bin out the way, and then the virus will die slowly there. Now the other thing is this virus, if we breathe it out onto a surface, if we cough, sneeze, breathe it onto a surface, this virus can survive on a surface for 5 days because of this protein coat that we talked about. This remember we talked about this protein coat that it's got. Can't find it now, but no, never mind. It's got this protein coat.
The crown,
that
guys,
protects
the
it.
crown.
And the virus can actually go into a state of dormancy, and it can remain dormant for 5 days. And that means if you touch something, a surface that someone has coughed on a few days ago, the virus can get into your hands. And then, you ever do that? Sort of have your hands around your face, or can you see all of those things are getting the virus from your hands into your eyes, your nose, your mouth, and that causes infection. This is why hand hygiene is so vital, that hands are well and thoroughly washed.
Soap,
and
water.
Certainly we want to avoid putting our hands up around our face until the hands have been well washed, or indeed anyone else's face if you're a healthcare provider. So the virus can survive, so it can be direct droplet, or it can survive on surfaces for 5 days. And a fomite is anything which is not alive that transmits infection. So a surface could be a fomite. An enclosed environment is much more likely to be contaminated. So if you're in an aeroplane or a bus or a train or a car or a small room with someone who's infected, you're much more likely to catch it, much less likely outside, fortunately. Now, what's not quite known about this virus yet, but it's suspected